also like to introduce our guest speakers. I've seen some of them have arrived. We have Mr. Mingo Sharif, one of the guest speakers. Mr. Mingo, you can say something. Maybe he's still sorting up himself. I'd like to also to first introduce one of the greatest counselors, Mrs. Juliet Katega. Our mom, we are so precious that you have posted you here. Also like to usher you in and say something before we start off.
Thank you. Good afternoon, everyone. I hope I'm heard.
Yes, you are.
Okay. I would like to thank you for organizing this symposium. It's timely, and just like one participant has said, every one of us is affected by the pandemic. And I trust from this discussion, we will all learn from each other. So I'd like to encourage all of us to continue to share the link so that a big number of us is part of this discussion. You're welcome once again, and thank you for the opportunity.
Yes, thank you so much, Mrs. Katega Juliet. I also like to remind our fellow participants about the topic. First and foremost, this is the Joint Universities Good Health Symposium. The major topic of the symposium, it's effects of COVID-19 on the mental health of students and how students can effectively contribute to the fight against the pandemic. Actually, we're trying to hear Mr. Mingo Sharif is back. Like to invite Mr. Mingo Sharif to something before we push on. Are you there, Mr. Mingo Sharif?
Hello, are you hearing me?
Yes, please.
All right. Good afternoon, everyone. I am happy to be part of this symposium, and
Yes.
I'm hoping to have the best from the deliberations we shall be having today. Thank you very much.
You can continue. Thank you so much, the counselor, Mr. Mingo Sharif. Take over. Honorable Maureen Sache, the Guild Health Minister of Mara, I'd like to take over from this junction for the next session as it's on agenda. Thank you so much. Honorable
Thank you.
Maureen.
Yes, please. Thank you so much, Honorable Nicholas. Yeah, as we await our first speaker, who is Madame Catherine Abo, to come and speak to us, I would like to invite Cleopatra to take us through a poem. Cleopatra, please.
Thank you very much, Maureen. You're most welcome, all of you, to this symposium. As you well know, we are here to talk matters of mental health, and to that effect, I have a poem entitled Strength. It's a spoken word piece seeking to put a new meaning to the word strength in regards to those struggling with mental health, because we know that nobody is perfect, but either way, you don't have to struggle alone. You can tell somebody and keep fighting continually and celebrate every little victory that you have won. I hope I'm being heard clearly. Can I get a thumbs up before I start?
Yes,
Thank
you
you
are
very
clear.
much. Okay. As a poet and a scientist, I want to share something about strength. Being strong. Poetry has taught me how to embrace weakness, and science tells me its own about strength. Science tells me that strength is the maximum load a material can withstand before it breaks, before it crashes under the weight of the world. It goes from elasticity, mood swinging comfortably, reaching points of no return, plasticizing, growing numb and number each passing day until it finally breaks. Strength. You see, I used to be one of the strong ones. On most days, I still am. Locking myself away, choosing silence, making peace with loneliness, willing the music to course through my veins like the lyrics are a life force and the drums are my heartbeat, demanding that the bass drown out the multitude of thoughts in my head. I was strong. No need to bother anybody. I was professionally silent. I used to be one of the strong ones. On some days, I still am. But from where I stand on the brighter days, strength is a verb. Yes, strength is a doing word. It's choosing to fight. It's getting out of bed and onto my knees each morning. It's opting to eat healthy, finally, instead of piling on the food like it's battle armor or avoiding it altogether like it's poison. From where I stand on brighter days, strength is calling in the Calvary, reaching out to a friend, a confidant, calling for backup on days when the world gangs up on you, when it's a lot less colorful, when everything seems lost and it's never found. Strength. You see, many die overstretched, fighting off demons, alone. Alone, they let the layers slip past each other with each strain, never wanting anyone to peel them, to look inside. It's all garlic and rotten cabbage in here. Let me be in peace, one piece. So how could anyone reach through those bars and tell them they have a beautiful heart? On most days, he doesn't feel a heart, let alone beauty. So he chooses strength. Strength. I used to be one of the so-called strong ones. On some days, I still am. But it's the weakness, the poetic, vulnerable weakness that pulls me forward each day. It's always the fault lines that let the light in, never the strength. It's done. Thank you for listening.
Thank you so much, Patra, for that poem. Now, we are going to have to listen from our very first speaker. Our very first speaker, Madame Catherine Abo. She's currently serving as the senior lecturer in the Department of Psychiatry at Makerere at Makerere University. She also serves as a visiting lecturer at Gulu University. Madam Catherine has published findings of her research on child and adolescent psychiatry and mental health. She has a number of citations and publications, and she was awarded as an award of the Young Minds Award by the American Psychiatry Association in the international category. Ladies and gentlemen, join me as we welcome Madam Catherine Abo. Madam Catherine Abo, you're welcome to speak to us. Thank you.
Thank you so much, Madam Moderator, for that introduction. Can I have the right to share, please? Can I have the right to share?
Yes, it's okay.
I mean to share the slides. I'm being told the host disabled participant screen sharing. Maybe you can enable, you can enable me to share, please.
Madam Catherine, you can share now.
Okay. Okay, so I've been requested to discuss or talk about mental health, and I have added there mental health and psychosocial support for university students during COVID-19. We can't talk about mental health alone without talking about psychosocial support. So what I'll try to do is very simple. I'll try and just go through what we need to understand: what mental health is, what psychosocial support is, and what coping, and how that is related to coping and psychosocial support. What causes poor mental health in young people during COVID-19? What are your sources of stress? And how does one keep mentally healthy? Because as we've always heard from media and from many other people, that COVID is here to stay. So how do we cope mentally during COVID-19? And then how can we support friends? How can we be our brother's keeper? And when do we know when to seek help from professionals? I won't waste a lot of time talking about the definition of health, because I think we all know that it's a state of well-being where physical, mental, and social well-being are complete and not merely the absence of disease or infirmity. Now, the definition of mental health was extracted from the definition of health. And again, this is an international definition by WHO. It is the capacity to think, feel, and act in ways that enhance our ability to enjoy life and deal with the challenges we face in life. Like right now, we are facing COVID-19 as a challenge. How are we dealing with it in the way that we continue to enjoy life despite? That is what that definition is saying. But to be specific, that definition also states that the individual, you and me, we should be able to realize our full potential. And we will need a whole day to just talk about realizing our full potential. But what does that mean? Just to give you a glimpse into that, I think about 2 years ago, the UN reported that Ugandans only realize about 30% of their potential. So that tells you that as Ugandans, we may not be realizing our full potential, and yet that is one of the definitions of mental health. We should be able to cope with daily stresses of life. We should be able to be productive and fruitful. Now, those two things are different. Being productive is different from being fruitful. I'll give an example of a medical doctor who has a clinic to run. Let me use my own clinic on Tuesdays. I have patients booked. They come and line up. There are 20 of them. And I can say that by 1 p.m. I should have seen all these patients, and I'll for sure see them and they'll go away. But as to whether I am fruitful is a different question. The patient has to come back and tell me, you know, doctor, you gave me this medication and I feel better. And now I can go and dig, or now I can go and do this. That means I am being fruitful. And then lastly, we should be able to contribute to our community. And so just to understand a little more, that we should be able to deal, we should have ability to function and deal with everyday life and everything that it presents. But also, we should understand that everyone has mental health. And it lies on a continuum. It varies over time. One time you can be mentally healthy, another time you may not. And then there are times when mental health is good and when it isn't. And we really must know that there is no health without mental health. We can't talk about health when we do not talk about mental health. So some studies in other countries has shown that mental health of university students during COVID-19 has worsened. The students have had financial setback. The students have difficulty focusing or maintaining focus, and the university closure leading to hopelessness and lack of purpose. And therefore, some people have become suicidal as a result. I mentioned that I've added their psychosocial support. So we also have to understand that term that includes two big words, the psycho and the social aspect. So the psycho simply refers to our minds, and it involves the internal aspects such as feelings, thoughts, beliefs, attitudes, values, while the social refers to a person's external relationships and environment. And this includes interactions with others, the social attitudes and values, the cultures, social influence of family, peers, school, and the community. So when we add the word support, this is the support that we all get from our families, friends, the teachers, health workers, community members, and even specialized services. The support that you get from Butabika Hospital, for example, from Mulago Hospital, are all encompassed in that word, psychosocial support. Now, in life, university students have to cope with many situations. But what is it? What does it mean to cope? It is to successfully manage something difficult or challenging or taxing resources available. Available for one to cope. And that the situations that we have to cope with are called stressors. Yes, events that are harmful, threatening, challenging, difficult, and the stress itself is the negative emotional states in response to events perceived as taxing our resources or ability to cope. But it doesn't help us much to just talk about stress, stressors, coping, without talking about resilience. So the capacity to manage oneself. The capacity to manage oneself in the face of difficult circumstances. The capacity to transform oneself in a positive way. I can tell you that even during these difficult situations, there are people who have transformed themselves in a positive manner, and they see things differently, and that is propelling them forward. The capacity to recover or bounce back. For example, when I fall, I am able to get back and stand on my feet. This is what we call resilience. And it is something that we need to talk more about. Now, I mentioned that COVID-19 disrupted our mental health. How did it do that? Our mental health is sustained by the environment we live in. Friends, financial abilities, spiritually, the church, the mosque, work, family, school or institutions. And as you know, this is the environment that has been disrupted. Yes, and it's been disrupted by COVID-19. So COVID-19 has caused disequilibrium and destabilized mental health of many people. Now, the things that result from this disruption, for example, some people may have no food. People have been feeling lonely because now they're out of the institutions where they have friends. We've heard that some people have left school. There's a lot of despair. There's increased health anxiety, helplessness, mindset shift from living to survival. All these things, we term them normal reaction to an abnormal situation. These reactions are normal, but the situation is abnormal. Now, why are we talking about normal reaction to abnormal situation? If it is normal, this is because if these situations are not handled now, later on they turn out to cause psychopathology, and people are actually turning up. People who had these reactions and were not handled well, they are turning up to hospitals, and now we are seeing high numbers of people with mental illness because of these reactions that were not handled well. So there is loss of pre-existing health, loss of social and educational infrastructure, and of course, human resource. Those are things we have to cope with. And then, of course, we also have to cope with what I've just mentioned, the normal psychological reactions or responses to abnormal stress. We've got to cope with additional mental disorders. I've just mentioned, we are seeing a rise in mental disorders. And then there are some people who already had pre-existing mental disorders in the general population and in the hospitals. So coming to the gist of today's talk is, how does one keep mentally healthy during COVID-19? I talked about building resilience. This building resilience is something that has to be ongoing. You do not build resilience when you have a catastrophic event. No, it's something that keeps on even in times of good health or good times. We have to keep on building resilience. And these are the key issues we look at. You have to tell yourself, I have friends and support through connections that include personal, family, friends, people in the community. So those are the resources that you have. Then you can also build yourself. And so you say, I am using and developing my inner strengths and skills. I came in when the poem was, I think, about to end, but I kept on hearing this word, strength, strength, strength. Strength has to be built. And that is part of resilience. Then you can say, I can use my problem solving and creativity skills to help myself. Now, if you've not learned how to solve problems, or if you're not creative, the bad times come and you'll feel hopeless. Yeah? And then I do take safe action to build and nurture my life. And in that way, you'll be building resilience. So what happens to that resilience when it comes? COVID has caused mistrust or even loss of friendships. Yeah. So it has affected relationships. It has affected spirituality, which breeds hopelessness and confusion. Activities are affected, which breeds insecurity. People are fearing they've lost their jobs. Yes. And then it has caused impulsivity and behavior and risky behaviors. Yeah. Especially for students, we've had adolescents are getting pregnant and all this. Some are taking alcohol. So then if you had built your resilience much earlier, then you know, I have relationships, I have this, I have the other, I am this, I can do this, you know, and then that helps you to cope. The other thing that we need to do in terms of keeping mentally healthy during this time is being self-aware. To be self-aware is to teach, it teaches us how to identify our emotions and be aware of them, what triggers them, and their impact on people around us. And this is part of what we call emotional intelligence. This skill allows you to spot your emotions as they arise and not after their devastating effects. It also helps you to anticipate the upcoming emotional reaction by defining and being aware of the things that drive you towards those emotions. So emotional awareness is very key in keeping mentally healthy. Then, of course, these pressures, as we've mentioned, the normal reactions to abnormal situation cause anxieties and fears. So it is important for us to know when we can't calm down, what is causing under us anxiety, and when we can't shut down. And this is the subject of the brain, actually. The function of the brain. So there's what we call window of tolerance, and that is the optimal problem-solving window where you are alert, you're engaged, and you can access both your emotional and reasoning brain. You can access both your midbrain and the upper part of the brain cortex, the reasoning part of your brain. So if you can't calm down, because you're saying you need to calm down, one must be calm first before being able to think clearly, before you can solve problems, before you can do your routines and make plans. So before you use your upper part of the brain, your limbic system must be calm first. So what are some of those things that cause you not to calm down? If you're emotionally distressed, if you're not thinking clearly, if you're overreacting and you're unproductive in problem solving, you need to do deep breathing. You need to be do mindfulness and grounding exercises. Now, I'm just going to illustrate what grounding exercise is. Grounding simply means you should be in touch with your 5 senses. Yes? Feel, if those who are seated, you can feel yourself on the chair, feel your feet on the ground, yeah? And that is touch. Maybe you can touch, feel the fabric you're putting on. If you're putting on jeans, it should be feeling rough. Yes, being a Saturday. Listen. And you can hear the birds singing. Where I'm seated here, cars are hooting and alarm cars gone off. So that means you're in touch with the environment. And then you can see and count the colors around. I can see purple, pink, red. You know, by the time you count those colors, you're beginning to use your upper part of the brain. You can't see colors. I mean, you can't count when you're not using your upper part of the brain. And then that takes you back to the window of tolerance. Sometimes we feel we are shutting down. We are getting depressed. We are lethargic. We are unmotivated. We are numb. Again, you need to do mindfulness, physical exercise, deep breathing will help to take you back to the window of tolerance. Okay, and then of course you need to limit information to only relevant information. We've talked about mindfulness. I'll not talk about that. I just wanted to flash this slide to tell you that there is science behind mindfulness. Yes? The scientific benefits of being mindful or being in the presence. One, it will optimize our telomerase levels so that we repair and maintain the ends of our chromosomes, and that should be healthy. It improves our cardiovascular risk factors. It reduces inflammation by altering epigenetic regulation of the inflammatory response. It reduces stress response. It enhances our immune function. And of course, it cultivates more integration in the brain, yielding more functional regulation of those processes that we are talking about, emotions, attention, and behavior. So it's really, it might sound simple, but there's a lot of science behind it. So of course, we need to learn to deal with our negative emotions. And just to let you know what negative emotions does to you, it can cause you migraines. It can cause skin rash, hormonal imbalances, tiredness, digestive problems, heart disease, constipation, insomnia, high blood pressure, trouble focusing, autoimmunity, memory problems. So once you realize you have negative emotion, you know you're at risk of any of these things. So it's important for us to know how to deal with negative emotions. Then, of course, you need to regulate your emotions. Because of time, we can't go into details. We need to think positively. A person has about 12,000 to 60,000 thoughts per day. And you know what? The default position of the brain is to keep us alive. So 80% of those thoughts are negative. So that, you know, it keeps on driving you to do something. So it's important to have a strategy that involves changing your thought patterns. Yes? Thinking positively involves reinterpreting your situation in order to change your emotional response to it. For example, the current situation is that universities were closed for 42 days. And of course that after some time people felt, we can't tolerate this anymore. Yeah. So how else would you reinterpret that situation in order to change your emotional response to it? Another example is you imagine a friend who you call or text and does not return in several times. That happens all the time. And of course, it causes you to feel bad about it. But how else can you think about it so that doesn't cause you negative emotions? So rather than thinking that this reflected something bad about yourself, for example, my friend hates me, you might instead think, my friend must be really, really busy. Yes? And research has shown that using a positive way of interpreting in everyday life is related to experiencing a more positive and less negative emotions. You can have a stress management self-help check in a week where you have a table like this and you think there are positive choices we make every day. For example, did you update your stress journal? Have you exercised for at least 30 minutes? Have you talked face-to-face with a good listener? Have you avoided unnecessary stress, for example, a person or situation, and so on and so forth? And you check yourself, you check your levels of stress. You must take care of your body. Yes? Keep clean, dress up. We have a habit of dressing up only on Sunday when going to church. And so when there was no church, people stopped dressing. They would stay in their night dresses the whole day. And by the time you know it, they are not taking care of themselves outside and even inside, even their emotions. So whether there is a church or not, dress up. Have your diet, your balanced diet, exercise, have enough sleep, and no alcohol or minimize use of alcohol, especially during these times of not being in school. We need to prevent overstimulation and increase the effects of happy hormone. And overstimulation simply means that you may be on your phone all the time and you're on and on and on without doing anything else. And then that causes overstimulation. It leads to, scientifically, overstimulation leads to desensitization of happiness effects. It leads to tolerance to the amount you receive. It leads to addiction towards the activity. So you do not want to get addicted to whatever activity that is. And those are the examples of common overstimulating activities: scrolling through your social media, always eating fast foods, binge watching of TV shows all weekend, and so on and so forth. So how do you prevent? Allow levels of happiness chemicals to drop to normal level to help maintain sensitization. For example, limit your use of the gadget by stopping after some time. Limit the frequency of use. Not using it like a drug, like someone has annoyed you, you go to the phone. You're disappointed, you go to the phone. You're frustrated, you're in a jam, you're in the phone. You know, you're using it as a drug. And do not use it as an escape mechanism. Okay, so how do you increase your happiness receptors? Abstain from overstimulating activities. You need to have high intensity interval training where you withhold the use. Digital detox. Detoxicate yourself from the gadgets. And cold showers and ice baths also help. And then, of course, you need to have time. Remember, we defined mental health as ability to think, feel, and behave in ways that enhance enjoyment, regardless of the difficult situations we are in. So how do we maintain enjoyment? We must make deliberate efforts to create positive experiences. We must use the good experiences to soothe the bad experiences. We must keep gratitude journal every day. Write down 3 things you are grateful for. Yes? And prayer works as well. You know, when we pray, we kneel down, we thank God, we thank, you know, we are thanking, we are grateful, we are grateful. That too can work. Enjoy what you love to do. For example, hobbies, yeah, and collect positive emotions. We mentioned that. So when you have achievements produce dopamine in the brain. Yes? It doesn't just come. You need to plan, be flexible, practice new routines, and that will give you achievements, and therefore it will give you increase on your dopamine. Complete a task and then celebrate the achievements. We're about to end. Now, the first part of dealing with or keeping mentally healthy is what the individual, you as a person, can do to be able to keep mentally healthy. This second part is the psychosocial support. And this is the care and support offered by caregivers, family members, teachers, health workers, community members to individuals on a daily basis. Now, remember, no man is an island unto himself. Man is a social animal, and that is why we talk about this social support. We need each other. You cannot be alone. Now, before we demand support from others, we must create a caring relationship. Yes? With the people around us, our siblings, the parents, the friends, the spouse, children, other family members, church members, community. Connect with others within the limits of physical distancing. You can keep on, you know, phone calls, social media, email, family, friends. Remember that the grass is greener where you water it. Where you don't water the grass, it will turn brown. And that is the same thing with relationships. We must create a caring relationship with others. So when we care for others and others care for us, we feel valued. When we feel valued, we produce serotonin, another happy hormone. Yes? You may find these care relationships in a best friend, family member, neighbors, caregivers. These relationships can be the most rewarding parts of our lives, but sometimes we forget to maintain them. Yes? For example, do you always wait to be contacted by friends? And then when they contact you, the first thing is to blame them. You are lost. Why haven't you been calling? But for you, what were you doing? Yes? Or do you only connect with friends when you need favor? And they'll mark you. They'll say, this person only calls when they're, you know. So the best way to fulfill your own interests, this is in your own interest, is to take care of others. Remember that you can't water the grass without water. So first, fill your emotional bucket. For example, have nice words. Be kind. Have helpful hands instead of hurtful hands. Be quick to help. Otherwise, your bucket will be full of, you know, symptoms of negative emotions, resentment, hurt, bitterness, you know, guilt, and eventually you can have depression and, you know, and other mood problems. So this just tells you what you should do. Your body, you can say, my head, I need to look for someone who I can relax and unwind with. My mouth, I have someone who you can regularly chat to. My shoulders, someone who you can share your problems with, and so on, your hip, your legs, and so on and so forth. And lastly is professional intervention. Sometimes because of many other factors. Maybe we are genetically predisposed. Maybe we had mental health issues before. Maybe something. We may not be able to help ourselves. We need professional intervention. So consult when you have lack of sleep, appetite, activity levels, anxiety not controlled, you're unwell physically, please consult. So how do you know who needs mental health and psychosocial support among the people around you? The expression can dictate, yes? Signs and symptoms, yes? Withdrawal, despair, hopelessness, helplessness, lack of basic needs, yes? And we really must be our brother's keeper. So suggestions of how you can start a conversation, for example, after identifying some signs, here's how you may start up a conversation with the person. You can say, I've been feeling concerned about you lately. Recently, I've noticed some differences in you and I've wondered how you are doing. Or you can say something like, I want to check it with you because you haven't seen yourself lately. Yeah? When did you begin to feel like this? Did something happen to make you start feeling like this? How can I best support you right now? Have you thought about getting help? And so on and so forth. So if you have people who are suicidal, in this talk, I think we're going to have management of suicidal thoughts or something like that. If someone is inconsolable, you can't console them. If there are changes or signs have gone on for so long, please refer them for assessment. So in conclusion, mental health is everyday life. It is basic survival. We can't say we have health without mental health. So just like the body needs food to survive, mental health too needs food that goes beyond physical food to include the environment, the friends, the institutions, all that is within the environment. So the environment and mental health must be in equilibrium to maintain mental health. COVID-19 causes disequilibrium, thus the need to build resilience much earlier and to learn skills of keeping mentally healthy. Learn basic skills of mental health and psychosocial support and know when to seek for higher intervention or when to refer. Take care of yourself. You can't give what you don't have. Be your brother's keeper. And in this way, we support each other. Thank you very much. I would now like to welcome your questions and comments.
Thank you so much, Madam Catherine, for that insightful presentation. I personally have learned how to help myself mute and ask your question.
Thank you very much, the moderator. Dr. Kathy Abo, thank you very much for the presentation. I'm called Ignatius Asasira, I'm a medical student at Makerere University. And my question is on the ongoing COVID-19 new normal of our education, our academia. You talked about trying to control our use of gadgets, but on a personal level and from a few friends I've seen, I must say we are slowly getting into phone and gadget addiction, partly because of the ongoing, Zoom after Zoom, meeting after meeting, class after class, and everything is happening on my bed. Like you're just seated in one position. Which tips or what advice would you give us? Because moving forward, we might be heading towards entirely online classes. So how can we still take care of our mental health? Which particular tips in relation to avoiding gadget addiction? Otherwise, thank you very much for the presentation. It was a good one, and thank you the organizers for such an idea, a topic discussion. Thank you.
Thank you so much, Ignatius, for that question, and a very insightful question. there. Yes. In order for addiction to occur, there is a pathway in the brain that we call the pleasure pathway that has that produces dopamine because you've experienced pleasure. Yes. So I think the stress of Zoom because of lectures is a different kind of stress. It is not the addictive type because unless you're going to tell me that each time you're on Zoom, you're producing happy hormones, you know, the dopamine and whatever. Personally, I find Zoom very tiring. I prefer face-to-face. And I think many people, many of my colleagues also prefer face-to-face interaction, because by the end of the day, it is so tiring. You get drained and worn out, and actually the dopamine levels goes very low. So it's the opposite, and the way to make sure that you do not get drained like that is to have breaks in between. Right now, how do we manage right now? We try to limit Zoom interaction for a minimum of, or a maximum of about 4 hours. So if you're starting at 8, by midday, you should not again be on Zoom and go do something else. The other alternative would be record. Yes, you can record, and the time you feel you are more able to listen and learn, then you turn it on. Otherwise, it may not help much to just be sitting there and your Zoom. And many times, actually, people just turn it on, they check online, and then they disappear. It doesn't make much sense. So people must regulate themselves, and the Zoom lectures should also be regulated to make sure that it doesn't cause mental health issues, really. Yeah, thank you. I hope I've answered your question.
Yes, Doctor.
Thank you, Madam.
Thank you.
Thank you, Madam Catherine. I'll now invite Nehemiah to ask his question.
Hello, good afternoon, everyone. Doctor, I was wondering, so we realized since we're having this trend of social media and we've all been for lockdown, you realize people that have suicidal thoughts end up using their status updates and other social media platforms to inform people that, you know what, I want to commit suicide, I'm going to use this drug and it will take me silently. So in the event that something like that happens, maybe on the status update, what should we do? Do we also tag the person and post on our status update so that you can get someone to help them?
Thank you so much, Nehemiah, for that question. Again, it's a very, very important question, and it's something that is actually happening. People who are distressed always communicate. They may communicate in their behaviors. They may communicate in writing. They may communicate verbally, but they always communicate. And it is us to pick up that communication. And of course, with the social media now, it's one of the communication channels for them. And as soon as the other people who are in in touch with this person through social media, as soon as they see this kind of post, it is important to reach out. I mean, if you've seen maybe on Facebook or WhatsApp, and you're also in this group, that means and you're a friend to this person in terms of, friend on Facebook, that means you can contact them. So, or at least become concerned. So you can find out exactly what they mean. You can reach out, just like I said, oh, I'm concerned about this post. Can you tell me more about it? Or if you don't feel close enough, reach out through friends who are close and tell them that I've seen this post. Can you just explore more and find out what is happening? And sometimes it might just be an innocent post. I'll give you an example. Not long ago, I saw on Facebook someone who is a friend on Facebook, and she had posted a verse in the Bible, and it said that, I think the verse was about either going to heaven or something that meant that she had to die fast or some. And then I picked up a phone and called, and I said, hey, tell me more about this verse. And then she said, some people just pissed me off. Yes. And I wanted to vent, and that's how I vented. So I followed a little bit more, and I thought, okay, she's really not suicidal. And then I left it at that. That's about 6 months ago. And she's okay. So it doesn't harm, even when you find in the negative. It's important because many times suicidal people slip through media. They slip through families. They slip through friends. And you hear stories when they've died that, oh, this person said this the other time. This person did this and that. So it's important. Wherever you've seen it, and particularly like for us in the mental health fraternity, it doesn't, I mean, it's, I can even introduce myself. I'm a mental health professional. I saw this post, I got concerned. Do you need to talk? Yeah, I am here, can we talk? Send me a message or something like that. So it's a good thing, even when the person is not your personal friend, it's a good thing to be concerned. And sometimes that is all they need, someone who is showing concern. And then they'll begin to talk. Yeah, thank you very, very much.
Thank you so much, Madam Catherine. Due to time, I will request the rest of the participants with questions to type them in the chat, and then Madam Catherine can read through and reply from there. Thank you very much. I will now invite our next speaker, Professor Pauline Biachika, who is a specialist and epidemiologist she has over 20 years of experience in clinical care, research, and training. She's passionate about mentorship and has mentored several junior colleagues. She has published over 50 papers in internally recognized peer-reviewed journals and is a member of the Uganda National Academy of Sciences. She serves on several boards and committees as a member of Ministry of Health Scientific Advisory Committee on COVID-19 and a commissioner on the East African Health Research Commission. Her overarching goal is to reduce morbidity and mortality through clinical care research and training. Professor Pauline, you're welcome to speak to us.
Thank you very much for that.
Professor, your network.
generous introduction.
Professor, your network is not stable. Professor, your network is not stable.
Share that I share. I just have a few slides as she and share presentation on mental health. Thank you very much for inviting me to give this talk. Sorry, can you hear me?
Yeah, we can hear you now, Professor.
Can you please confirm? All right, so I will go ahead and present without. Okay, can you confirm that you can hear me?
Yes, we can.
All right, so I was asked to talk about the role of medical students in the fight against COVID-19. I hope you can see my slides. I just have a few of them. Can you see the slides?
Yes, we can.
All right. So Dr. Abo has done a good job talking about mental health. And I hope that that will form a good background to some of the aspects I want to discuss. So we all know COVID-19 is an infection caused by the coronavirus, called the severe acute respiratory syndrome coronavirus 2. It originated in China, Wuhan City, in December 2019, and it was declared a global pandemic on March 11th, 2020. In Uganda, the first case was identified on March 21st, 2020. And since then, we've had many infections to the total tune of over 96,000 in Uganda and over 2,800 deaths in Uganda. So the disease COVID-19, I said, is caused by the SARS-CoV-2 virus, and its incubation period is on average 5 to 6 days, but varying from 2 to 14 days. The mode of transmission, it's important for me to give you this background because it will be very useful to the later points that I'm going to discuss. It is mainly spread through respiratory droplets and also contact with contaminated objects and surfaces. That is, if you touch contaminated objects and then you touch the mucous membranes of your eyes, nose, and mouth. Then aerosol generating procedures in the hospital setting, such as bronchoscopy, tracheal intubation, CPR, induction of sputum, airway suctioning, and passage of nasogastric tubes also is another route of transmission. Then in indoor settings where there is inadequate ventilation, this virus remains highly infectious as aerosols, potentially for long hours, and it can travel for tens of meters before landing on surfaces where the virus will be able to survive for up to 6 days. The route of entry into the human body is through the upper respiratory tract or facial mucosal surfaces, where this virus gains access into the cells by binding to the ACE2 receptors. So health workers and COVID, given that background, we know that health workers are central to the COVID-19 pandemic response. Health workers are involved in the general mitigation of the pandemic, but also in the clinical care of patients suffering from COVID-19. At the same time, these health workers have additional essential service delivery roles, which they have to continue with, things like maternal health services, surgical services, immunization, and other essential services to do with health. This puts health workers at increased risk for infection because in many of those areas, especially the OPD areas, outpatient areas, and also some inpatient areas, patients might have COVID, but they are not diagnosed. So health workers may not take the necessary precautions, and therefore that will be placed with increased risk of infection. Health workers also are exposed to hazards such as psychological distress, fatigue, and burnout. I'm happy that Dr. Bo has really elaborated on that very well to answer what should be done when you're faced with such psychological distress. The hazards to the health workers are real and significant, and they cause a lot of problems. We also know that over 3,000 health workers have been infected with COVID-19 to date in Uganda, and over 50 of these have died. And some are currently suffering from what we call the long haul COVID. These health workers are a mixture of doctors, nurses, lab people, and other health workers, including the support staff in health facilities. We also know that some of these health workers have got infected in their communities, while others are probably being exposed in the health facilities. As I said, some patients are undiagnosed and they're not necessarily in the COVID treatment unit, and health workers may be attending to them without having appropriate PPE, and hence increasing risk of transmission. We also know that health workers are obliged to train and mentor the next generation of health workers. So it's part and parcel of our role to train the next generation of health workers. I will now turn to the medical students. We know that medical students are students, as the word says. They're not registered health workers. And of course, this comes with its limitations. Since they're not registered, they're not licensed to practice medicine. Their learning, especially the clinical years of study, is practical, more practical than theoretical. The theory, yes, gives you the theoretical basis of the subject, but you need to learn the clinical skills and interpretation of medical information practically, and that is in the wards and the OPD clinics when you are interacting with the patients. Students also participate in clinical care of patients. We know that, say, on a routine ward round, students will clerk patients, they present to the teachers, and in that way, they're helping to get information from these patients. And this information is used, contributes to patient care, but also students participate in various procedures on the wards, like putting up IV lines, doing some procedures, and this is all part and parcel of patient care. So students contribute to the care of patients in the hospitals. Students also are at risk for infection, especially in the clinical setting. Yes, they are at risk in the communities, but if you come to the clinical setting, say, for example, at an accident and emergency department, or even on the wards, and there are some patients who are undiagnosed and they're mixed up, you don't know who has COVID-19 and who doesn't have, then there's some risk of infection in that setting. At the same time, these students have the potential to act as vectors of transmission to the patients, to clinicians, and to the community. If you come from the community and you're infected, you go to the ward rounds, there's potential to transmit to the patients on the ward and other clinicians. Or if you're infected and you have to go back to the community, to your halls of residence or hostels or back home for those who might be resident in their homes, you still have potential to transmit the viruses to people in your homes and in the communities. And while at work, just like any health worker, medical students require personal protective equipment. Amidst scarcity of this equipment, they must be provided, or they must provide themselves with personal protective equipment. And this equipment may not necessarily be the full gear of equipment, but it should be appropriate for the level of care that they are providing and the care level where they are working. Then the teaching and learning environment, regarding students, we know that students are affected, but also the teachers are affected. Teachers' routines are interrupted. Teachers tend to spend less time on the wards in terms of crisis like that because they want to reduce exposure time. But we also know that many patients run out of hospitals during this time, so the number of patients on the wards is much smaller than ordinary. So the learning environment is modified, is reduced in terms of the time of exposure to learning, but also in terms of numbers of patients that students can clerk and examine to be able to learn very well. Then there is risk and liability issues. We know that as I started off, I said medical students are not registered health workers, they're not licensed. So there are liability issues in case anything goes wrong to the patients, okay? They don't have insurance, but also on the side of the students, since you're not a health worker and you get infected and probably get severe or critical disease and either die or get recovered, but with some disability, the parents are concerned. And that's their major concern as parents, that you see, my child is only 20 years old or 18 or 19 or 22, and getting them to end their life very early because they are participating in COVID care may not go very well with the parents. So there are parental concerns, there are community concerns, and there are ethical concerns regarding getting these medical students to be involved in the COVID-19 fight. So this slide is just to tell you about PPE, personal protective equipment for COVID-19. As you can see, level 1, you may just wear a scrub, and you might have a mask, a community mask, cloth mask, if you're in just the environment, but not necessarily in the clinics dealing with patients. Level 2, if you're dealing with patients, say in an OPD, you might need scrubs and you might need a mask and a shield. Depending really on which level of care you are at, you might need different PPE, but we know that there's scarcity of PPE because everywhere globally, everybody's looking for PPE, and therefore we may not have enough for everybody, including the students. Then I'll talk about the effects of COVID-19 on the medical students. We know that there has been a lockdown. This is the second lockdown. There have been university closures. The first lockdown, the university was closed. The second lockdown, the university has been closed. It opened yesterday. And these closures have caused semester delays, examination delays, and of course, graduation delays. And that will subsequently lead to delays in career progression, as well as delays in finding jobs. Mental health issues, Dr. Bo has elaborated on that very well, such as fear, anxiety, and also access to mental health care is an issue, especially for medical students. We also know we have moved on to online classes, access to smart gadgets, laptops, phones, smartphones, and access to the internet might also be an issue for some medical students. We might say we offer online classes, but if students can't access these gadgets and internet, then it still affects their learning. The semester cuts, as you saw following the first lockdown, we did not have a lot of time, so the semester was cut. And then you came back, say, for example, those who were in Makerere came back, and there were many, logistical issues and they did not start on time. So there were semester cuts causing shortened clinical exposure and shortened learning, inadequate period of learning. And this may affect your professional development, because if you do not acquire enough knowledge, then you may not necessarily become a good doctor at the end of the day. And this will definitely have effects on your future career choices, because some may have wanted to be internal medicine physicians like myself, but then they start to think about COVID-19 and having to work with COVID-19 all through the next years of their careers. And then they may decide, no, I don't want to be an internal medicine physician. I want to be a surgeon, or I want to go into public health, or I want to go into management. So yes, COVID-19 pandemic will have an effect on some future career choices. So what is the role? Having given you that background, I'm going to talk about the role of medical students in the fight against COVID-19. This COVID-19 pandemic, while it comes with a lot of challenges and a lot of fear and anxiety, a lot of logistical challenges, a lot of morbidity and mortality, and so much economic and social disruption, it also offers a learning opportunity. It's a new disease. There's a lot of unknown. So it is a great learning opportunity, learning about the disease itself, learning about management of a pandemic. And this might call for voluntary participation as a medical student, because as I said, medical students are not licensed health workers, and therefore they cannot be forced into getting engrossed with the management of the pandemic as well as the clinical care, because of their lack of the license and not being registered medical workers. But the role of medical students on a voluntary aspect may be voluntary participation in some of these aspects. And indeed, during the first and second lockdown, we got some students who volunteered to participate in various aspects. And of course, we advised them not to go into the very risky areas because of their inadequate knowledge on infection prevention and control. And many of them participated in things like attending meetings to learn about pandemic management, taking minutes for meetings, and data input, data entry, things like that do not have very high risk. The other role of medical students is for them to understand the prevention aspects of the disease and actually take up this prevention as individual medical students. And this is, for example, getting vaccinated. That is the role of a medical student at an individual level, because we know the rest of your life and career is going to be in a clinical setting. You're going to interact with patients, you're going to interact with the community. So to reduce the risk in this clinical learning environment, it's important that you understand the literature on the vaccines, and you get proactive in terms of knowing which vaccine to get and taking that opportunity to get vaccinated with whichever vaccine is at hand, instead of waiting for you to get infected and then getting down with disease. So vaccination is voluntary and it is an individual choice. The vaccines have been offered to the health workers, including students of health professions, and that would be another role of a student, to get vaccinated at individual level. Then we know that clinical care continues despite the pandemic, despite the lockdowns. So we have essential services that might be, essential clinical services that might be in the outpatient department, in the inpatient departments, offering clinical care of non-COVID patients, offering care to patients with chronic diseases like diabetes and hypertension in the respective clinics, and even things like antenatal care. So here, medical students could participate, but still this would be on a voluntary kind of role as a medical student. And then medical students could also participate, especially the senior clerks, to continue working with senior house officers so that the senior house officers can guide and supervise your work during this time in those various areas that are kind of low risk for COVID that I have just described above. Then the other active role for medical students would be to continue with the learning, reviewing the literature. As I said, this is a new disease and literature keeps changing. There's a publication every now and then, there's a review paper coming out every now and then. So as a medical student, this would be a very key activity, reviewing literature, conducting journal clubs. I don't know if you medical students have been conducting these journal clubs, but at least for those in Makere, I have frequently sent them the links for our journal clubs as Department of Medicine, and I hope that they were useful. So journal clubs on this literature, and because the literature is fast evolving, it's important that you participate there. Then patient education and community sensitization on the disease, on the standard operating procedures, on the vaccines. We know that the communities out there have various levels of understanding about the disease, but as a medical student, we know that the moment you get into medical school, you start to train as a leader in the medical profession. And whichever community you're in, even in your own home, you start to behave as a leader in the medical profession. And your role is to understand the literature out there and to sensitize the community, whichever community you live in, however small it is. It might be just your core family in the home. It might be a group of a clan on a WhatsApp group somewhere, because there's a lot of myths circulating. So your role is to really bust those myths and give people the correct information, sensitize them, and increase adherence to standard operating procedures, and also increase uptake to vaccines. We know that in Uganda, we have the home-based care for COVID-19 patients who are having only mild symptoms, and also explaining to those who are asymptomatic the importance of home isolation. And here, I was thinking that medical students could participate, and this could be on online kind of service or a telephone service where you explain to patients what they're feeling like, what the symptoms are like, allay their anxiety if you've understood the disease, explain to them the importance of seeking care if they have comorbidities, and explaining to them the importance of understanding why they need to seek care when they have symptoms. So under physician supervision, medical students could participate in this kind of thing. We know that currently home-based care is mostly offered by volunteer health workers in the communities. And yet we know that medical students have a lot more knowledge and could read up and understand many of these things more than the VHTs. So this is a good opportunity for medical students to participate. The other one is mini rounds and grand rounds. I don't know about other universities, but at Makere, Department of Medicine, we continue to have mini rounds and grand rounds. So medical students could still participate as passive attendants, attending these mini rounds and grand rounds, but you could also ask for an opportunity to read up some literature for a particular case presentation and make a presentation. So medical students need to be proactive, find opportunity and ask the person in charge and say, can I do something here? Or what role do you think I can do here at this mini round or at this grand round? And the opportunity will be given to you. Then the other role for medical students, we know we've had this long lockdown and this long period of university closure. As a medical student, we know that in the medical school, we mostly get information about the profession that we are studying to become. But we know that there's a lot more, especially now with this COVID pandemic. There's going to be a lot of online learning, a lot of artificial intelligence, a lot of other roles that are going to be done online. And there are many other skills as a medical student that you could take on and learn during this time of closure. In acquisition of additional skills, for example, skills in data analysis, using particular software, different kinds of software, such that when you come back, you're able to work with your teachers or supervisors to do some data analysis or data entry, or even make PowerPoint presentations. There's a lot of need. Every teacher everywhere is always making PowerPoint presentations, even you yourselves as medical students. But you'll be surprised how many students do not even know how to use the PowerPoint software. Other things like online basic courses in basic leadership, management, financial management, and other soft skills, as well as other practical skills. So some medical students could keep home because there's a lockdown, they do nothing, they don't learn any other skills. But there are other skills out there that you can learn and use in future. If you're in a home setting, you might learn baking skills. If you're still in a home setting, Dr. Bo was talking about other therapies that you could use for mental health. So you read up about mindfulness so that you can teach people about it. And those are additional skills that become very beneficial later on in life. The other role of medical students is to participate in research, of course, under supervision and guidance, okay? So you could participate as a research assistant collecting data, for example, in community surveys. You could conduct simple studies, knowledge, attitude, and practice studies. And you could even write scientific publications. I know one medical student in Makere, Olum, is he called Olum? Yes, Olum. Very active in scientific publications, has teamed up with senior house officers, and they are publishing at a very terrific speed. So medical students could take that up, and I encourage you all to do that. So for the future, my thinking is that there's a lot of potential for participation of medical students participation in future pandemics and in lockdowns. We know that this may not necessarily be the last pandemic. We might have another pandemic of a different disease altogether. But even with the COVID-19 pandemic, we know that we're anticipating the third wave of the COVID-19, and there might be another lockdown in the future. But if medical students are properly trained, they could be incorporated in some of these healthcare teams, especially outside the COVID treatment units, where they can still continue to participate. The medical students could also take on disaster and pandemic training programs. We could do that as universities to prepare medical students for participation in future such pandemics so that they can acquire knowledge and skills. Lockdown and closure of medical schools, of course, there are many thoughts about that. Some people think it's not the best thing to do for medical schools because our role is to continue producing medical health workers, okay? So closing a medical school during a pandemic is thought to be not a very wise way of doing things, but because of the inherent risks that I talked about, many countries decide to close medical schools. But we have seen some countries leaving the medical schools open. So that's really something for discussion and something that your students association could take up for discussion with the higher authorities to consider or not to consider keeping medical schools open in the future, knowing very well the risks that are associated with it, and probably putting in place some mitigation measures to counteract those risks so that medical schools continue. Because if you stay home and the teachers are managing COVID, you do not learn to manage COVID, or you do not learn to work in an environment where there is possible COVID. But you're training to be a doctor. So when you come back after we have managed COVID, and then tomorrow you're graduating as a doctor, and there's a fifth wave of COVID, and you're the doctor on duty, what are you going to do? You will have missed the opportunity to learn that. So it is really food for thought, and something that your association could discuss deeply and consider discussion with high authorities. Then it's important for the future that we boost online education so that we don't have these gaps in learning. We continue with the theory learning, continue with the mini rounds and grand rounds to be able to continue offering this training. But we know that for clinical training, we need practical skills. So online education does not really cater for the clinical skills acquisition. And that is a discussion that needs to be held. Then it's important for future to have these programs for students' mental health well-being. There might be physical programs where a student comes in to meet, say, Dr. Abo, but we could also have these ongoing online sessions and also telephone numbers to call if a student has a problem and is feeling so distressed and is feeling like jumping over a building. They have a number to call and say, you know what, I feel like jumping over this building, and they will immediately get help. So I think those are some of the future thoughts that I had. And I'll stop here for now. Thank you very much for listening. Over to you, Chair.
Thank you so much, Professor, for that wonderful presentation. I think all of us have learned something from your presentation. I request people with questions to put up their hands so that they can ask their questions before we break off to the rooms. Kenneth, please, you can unmute and ask your questions. Your question.
Well, thank you so much, Professor Baita, for such a wonderful presentation. I don't have a question, but I only have a comment, a reaction. I would like to inform all the medical students that your role is not only to sensitize the community in preventive measures and strategies to reduce the risk of getting COVID-19, but also positioning yourself in a manner that you can create something new, create new medicines that can avert the disease. So we should not only depend on the Western countries to advance our health, but also look for ways how we can come up with new medicines so that we can fight against the pandemic. Professor did say that we might have another pandemic. And now the question becomes, should we always wait for the Western countries to provide the vaccines before we, the Ugandans, come up with our own vaccines? So this is a responsibility of the medical students, the scientists, to really think authentically outside the box and be able to invent those new medicines. In that way, we'll be able to improve the health status of our country. Thank you so much.
Thank you so much, Kenneth. Breen, you're welcome to ask your question.
Thank you so much, finalist. It has really been a nice session and we have learned a lot.
Thank you, Dambia. If I may react immediately.
Hello.
Can I say something about that submission?
Okay, Professor.
Hello, Chair. Yes. Thank you. His name is Eldad Dambia. Thank you for your submission regarding development of medicines and vaccines. It's a good thought. However, we know that development of medicines and vaccines really takes a lot of scientific input and a lot of resources and a lot of time. By the time a drug or a vaccine is put out for use, really there's a lot in terms of science that has gone in there. So that may not be an immediate low-hanging fruit for a medical student. It might be a very tough one for a medical student. I know that as a country, we have got more and more people coming up to say that I have a drug that treats COVID, COVID-X, COVID-Life, and all that. But it's important that if we are to get onto the global picture in terms of drugs, if a particular drug is to get onto the global picture to be internationally recognized, it's important that that drug goes through the right steps of production and the right steps of approval. So currently we know that even things like COVID-X that have already been notified by NDA are still going to go through clinical trials to be able to be talked about whether they are efficacious or not. So you don't just sit down and say, yes, I have this herbal medicine and it treats COVID and I'm going to put it out there as treating COVID. You still have to go through the right steps, and that takes a lot of scientific input, a lot of laboratory work, and to get into the phases where it needs to be tried in the humans. So it might be a very tall order for you to give to medical students at this time point. Over.
Breen, you're welcome to ask your question now. Thank you, Professor.
Thank you so much, the panelists, the comrades in the meeting. I greet you all in the name of the Lord. I'm Dr. Robert Breen, a student from Barry University of Science and Technology. Yeah, I've been following the session from the first presenter to the current one, and we have learned a lot. But now, you see, as COVID-19, there are so many things that are supposed to be done. For example, we find out that deep in the villages, people are not yet aware of COVID-19. The preventative measures, people are still reluctant to enforce the SOPs. But now, it beats my understanding. The government is spending on other things that, other than health. I really don't know the future of our country, because if the COVID-19, the third wave happen to come, we don't guarantee the safety of our nation, the safety of our people. So I think the government should have to prioritize the health issues other than spending in the useless thing that cannot really help in the country. So I really want to house that all of us we have a role to play as far as COVID-19 is concerned. It is not only the battle should not be left on the medical practitioner only, but all of us, we have a role to play. First of all, we have to, in our different localities, we have to really talk to our people. We should have to enforce the SOPs. In that, we shall be in position to contain the virus. In that, we shall be in position to help one another live a healthy life. Otherwise, I don't have a question. Thank you so much.
Thank you so much, Brain. Does Professor have something to say about that before we go on to the next?
All right, thank you. He's talking about everybody having a role to play. And I mentioned that in my presentation, that medical students should participate in educating and sensitizing the communities on the COVID-19 disease, the modes of transmission and prevention, adherence to the standard operating procedures as provided by the Ministry of Health, and also information on the vaccines to increase uptake and reduce the hesitancy of vaccine uptake. So that is one crucial role of a medical student. And I mentioned that you don't necessarily have to have a big gathering. No, you can start in your own home. I know that even in the homes where you live, there are people with myths about COVID. There are people who don't believe COVID exists. There are people who believe the vaccines are not good. There are people who believe COVID is transmitted in different ways, not the ways that we know. So your role as a medical student is to read, acquire the right information and pass on that information to the community. I see a question on the chat saying, with respect to Kenneth's concern, we have had so many innovations towards COVID-19, but most are not known or taken up by the public. How can we boost implementation, uptake, scalability, and sustainability of innovations, both towards the eradication of COVID-19 and other health issues in Africa, or particularly in Uganda? So as I said, many of these innovations you're talking about, like the drugs, the natural remedies, have not been tested and tried. So you cannot scale up something that you have not tested and tried. And that is what the Ministry of Science, Technology and Innovation is currently working on, to test those products, to show if they actually have any effect at all, if they have any benefit, and if they are safe. The most important thing is to know, are these products safe? And then two, if they are safe, are they efficacious? And if they're efficacious, what kind of efficacy do they have? Is it an immunological efficacy, or is it a viral clearance efficacy? So these products are going to be tested. There is already plans by the Ministry of Science, Technology and Innovation to test these products that have been brought up, to be able to get answers to these. So that can only, the uptake can only be talked about once that information is out. But currently, they have to be either used as, for example, Covidex was notified by NDA to be used as a supplement and not necessarily as a treatment. So you cannot expect the Ministry of Health to stand up and say, yes, we have to use Covidex, or you can't expect doctors to prescribe Covidex when that information is not there. Because the innovators, yes, have said in the communities they have used these products, but they have not tested them. So they're going to undergo clinical trials to to be able to know if the products are safe and two, if they're efficacious. I think those are the only questions for me. Thank you. If there are no more questions, you'll allow me to log off so that you can continue.
I think there is one last question from Ignatius. Ignatius, please unmute.
Yes, thank you. Mine is actually not a question. It's just a compliment. Thank you, Prof, for the presentation. To the students who are on, I wish to kindly inform you of an ongoing nationwide campaign within medical students against COVID. That's the title. And we are doing a home care based online campaign to inform everyone out there how they should do self-home care for COVID-19, just like Prof said. And the link is in the chat. Please feel free to register on the link. We shall be grateful for joining us. Thank you. Have a good afternoon. Yes, that's the link, Piga COVID. That's the name of the campaign. Thank you, Nelson, for sharing.
Thank you so much, Ignatius. Professor, we are very glad to have had you here. Thank you so much for the presentation and for that insightful. Now I will welcome Honorable Nelson to take us through the next session where we are going to talk about different subtopics.
Yes, thank you so much, Honorable Maureen Chisachi. My name is Nelson Sawanyana, fourth year student of medicine and surgery and the Guild Health Minister, Makerere University. Right now, we are going to our breakaway sessions, and they are going to be 3. So we are going to avail you with an opportunity for you to choose which session you would like to enter into. And then we are going to have much more comprehensive discussions about aspects of mental health. I really hope you can go into a place where you are comfortable and you can contribute and learn from the colleagues and experts in those directions. We are going to have room 1 that is going to be about depression and anxiety, room 2 that is about how dealing with PTSD, and then room 3 about suicide prevention. So you should be able to choose a room and you get involved in those discussions, and then one of the people from those rooms will be able to come and share with us that what they will have learned from that side, and we share the knowledge so that we can be able to get what people have learned from the other side and integrate with what we have learned from this side and really have a great mental health. So that is our next session, and they are the breakaway rooms. And I would ask the Tulifena Foundation to present the rooms so that people can join. Yeah, when you look on your upper left corner, there are breakout rooms. You can choose a room of your choice and join right now. Upper left corner, join the different rooms where you are willing to have a discussion. We shall be having Miss Katega in one of the rooms, Mr. Sharif Muyingo in the other, and then Miss Mary Akol Nagawa in the other, with the different moderators. So please join the different rooms of your choice and get involved. Thank you.
omuntu alina maani.
I'm not sure how much time we've been given. I need to be informed about this because I may shoot up and go beyond the time we're required to be in this session. Please, moderator, let me know when I've used up my time. We are supposed to discuss depression and anxiety, how to manage them. But before we get there, I would like to talk about the mind briefly. The mind is like a garden. It's like a garden which requires attention. It requires renewing. It requires pruning. When the mind is not given the attention that it and from the discussion of Dr. Abo, we find that good mental health or a positive mind is everybody's desire. But many a times when our mental health is not positive, and for that matter, we let the mind make conclusions over matters concerning us, some of which lead us to become anxious and depressed. In the context of the life that we are living now, there is a lot of fear, there is a lot of anxiety, there is a lot of worry because of what is going around in our lives and in our communities. And it is upon us, colleagues, to determine which direction of our mental health we should take. If you can recall from Dr. Abo's presentation, our mental health lies on a broad spectrum. On the extreme end, which is negative, is bad mental health. And the extreme positive side is good mental health, which is everybody's desire. But many a times when conditions force us to take the negative direction and we develop mental health concerns, which at times may require us to see or visit psychiatric doctors. It is my desire and everybody's desire that we all take charge of our mental health and remain on the positive side of the spectrum and be able to enjoy life as it should be. Okay, what is worry? Worry takes place in the mind. And worry causes the mind to focus on only negative thoughts. If you consider what is taking place now, the COVID-19 pandemic, the lockdown and all the associated cohorts, you find that the outcome of our worries is fear. Fear of being infected, fear of death, fear of losing others, friends, colleagues, dear ones, and it affects the way we relate with ourselves. However, when worried, the normal worry, if we are to look at the continent, the spectrum of worry, the positive side of worry will help us to, obey the SOPs. It will help us to take care of ourselves and take precautions as they are given to us. We'll wash our hands, we'll keep physical distancing, but excessive worry will lead to anxiety. We would like to see the relationship between worry, fear, and anxiety, because anxiety does not exist on its own. It does not come just like that. It will begin with worry, it comes to fear. If it is intensified, then it is anxiety. When you get anxious, you lose confidence in yourself. Therefore, if we are to ask ourselves, what is anxiety? Anxiety is an intense and excessive or persistent worry and fear, which, if not properly handled, will cause us to fail to manage life. It will cause us to fail to be who we are. There are many signs of anxiety, which I cannot name, but I know you know. We may share them in the chat room. However, anxiety, if not checked, can lead to depression. Feelings of anxiety in this period of COVID result from an unknown fear, an unknown event. You may be anxious right now that you're not going to finish on time, and it is obvious. You are not going to finish on time. A program which is supposed to be 3 years may take 4 or 5. We do not know when the total lockdown will be lifted. We have started the lifting of the lockdown, but in phases, and we are still going through these challenges. Now, when we become so very anxious and we are not able to manage our lives, it becomes difficult for you and I to relate with the environment around us, and it stops us from thinking straight. If not checked, ladies and gentlemen, excessive anxiety will interfere with our daily routines. And when that happens, you can imagine what may follow next. For that reason, friends, I would like to encourage all of us to be cautious of our emotions, to be cautious of our feelings. Truth be told, our bodies have a language. I may know that I'm anxious and another person doesn't know. For that reason, we should be open. We should be purposeful at understanding the language of our bodies. The body will tell you that you're anxious, and you should be able to handle those feelings when they come. I would like to, in a short while, talk about depression. How does depression begin? Depression progresses. It progresses from fear, like I said. It progresses from anxiety, and it will progress if it is not monitored properly. Normal depression is okay. For instance, if I lose a relative, of course I'll be depressed. My feelings will be low. I'll feel guilty, especially, for example, if I did not participate in helping my relative or friend to get the proper medication. But it can develop and it crosses over to the other side of clinical depression, where somebody will be required to be maybe admitted or that kind of stuff. So what am I trying to say? Whether anxiety or depression, fear, name it. If they are not properly handled, they may lead us to a situation where we cannot think straight, we cannot enjoy ourselves, and we cannot have a peaceful life. Depression, when we place it on the spectrum of mental health, there is normal depression. There are tests, psychological tests, which are used to measure the levels of depression, the levels of all these mental health concerns. But if these tests shoot up, for instance, if you measured, normal depression would be from, let's say, 0 to 4.5. But if it goes beyond 5, that is clinical depression and you need medical attention. So at this point, friends, we need to acknowledge our thoughts. We need to know, we need to monitor our bodies, we need to monitor our thoughts, we need to monitor our feelings, and be able to know whether our thoughts, our feelings, especially, for example, the feeling of depression is going beyond control. We should be able to live a day at a time and do not look too far ahead because you don't know what lies tomorrow. And for this reason, friends, I would like to ask us to look at, moderator, please. I would like to encourage friends to share in the chat room some of the symptoms of depression or symptoms of anxiety that they have had, so that we are able to check and ensure that we are on the track. When we consider depression, for example, and look at depression from the perspective of the pandemic, the social distancing restrictions, the bereavement that has taken place during COVID, the prolonged fears of death, because many of our friends have died, have caused a lot of depression among us, to the extent that there are people who are even thinking of suicide. Somebody mentioned this in the larger discussion. And we are saying we should be able to identify these feelings and know how to manage them. Good thing, doctor has mentioned some of these factors, some of these issues that we need to consider when we are dealing with depression, with anxiety, with fear. And I'm just doing a recap because most of these issues have been talked about. If I can look into what has been said so far, Mr. Moderator, please, what is in the chat room? Has anybody shared with us the symptoms they have had in relation to anxiety and depression feelings?
Yes, I can see that Hillary has got chronic fatigue, then we have difficulty in concentration. Abaza is saying the self-isolation. That is what is there. Thank you.
Okay. And those symptoms relate to depression. Those symptoms relate to depression. Could we have something to relate to anxiety?
I have
Any
more.
sharing? Sorry?
I have more chats here from Shamia Namuko says she added nervousness, restlessness.
Yes.
He's having difficulty in decision making. Brian
Yes.
is also restlessness, also feeling of loneliness from Geoffrey, then panic.
Okay.
Thank you.
Thank you very much. Yes, some of the symptoms of anxiety include feeling restless, nervousness, feeling tense, yeah, and these situations, these body reactions may cause you to lose appetite. They may also cause you to have sleep disturbances. Doctor talked about insomnia. That is anxiety. Depression, we have examples like loss of appetite. Someone can be demotivated to do things that they used to enjoy most. There could be suicidal ideations. Some people lose weight, others gain. There could also be body aches, stomach upsets, to mention but a few. Now, friends, some of these symptoms, when they come, we are tempted to run quickly to a pharmacy. We run quickly to a drug shop and buy medicine. That could be a coping strategy. But like I said in the beginning, when you're dealing with anxiety and depression, be able to understand the communication of your body. The body will tell you how it is feeling. Many a times when we go to a clinic, to a drug shop, and maybe you're able to find a medical person and they will tell you, they will ask you, how are you feeling? And if they are able to do a medical, a blood slide and find there is no malaria, sometimes it is these feelings. Mental health, doctor has said, mental health, I mean, physical health is not health without mental health. You can have symptoms that are identical to bodily pain, but then the real cause is a mental issue, which is either anxiety or depression. Now, how do we deal with anxiety and depression? Other than running straight away to a pharmacy to buy a painkiller, to buy diazepam to sleep, and that kind of stuff. Let's consider the following. On top of what doctor has mentioned, we should be able to acknowledge that these feelings of anxiety and depression are normal. They are normal. So if you feel anxious because of something that you anticipate may happen, you get prepared to handle it before it comes. Depression is normal. When we lose those that are dear to us, when we lose things, for example, students have lost a year or two, it is not the end of it all. When we are beginning to get depressed, we should be able to monitor and know this is, I'm tending towards depression, and you'll be able to plan for whatever you think is causing you depression, so that by the time it is real hard on you, you have a plan. Friends, we should be able to live a day at a time. How should we live a day at a time? Plan, make short-term plans. Make short-term plans that you can handle so that you're not overwhelmed with these emotions. Purpose to break the chain of fear. For example, fear is about a known experience. For example, if you fear to fail, what do? You prepare and read hard so that when exams come, you're ready. Fear helps us to plan, just like anxiety. So break the chain so that you're able to know that when worry happens now and I'm ready to confront it, you're able to break the chain of worry from progressing it to, from it progressing to fear and anxiety. We should be able to create self-care routines. Be able to create self-care routines where when you become anxious, you're able to do something that helps you to regain yourself. What are some of these self-care routines? You may have, for example, exercises like taking a deep breath. You breathe in, hold your breath, for example, like for 10, 20, 15 minutes, then breathe it out slowly when your eyes are closed. And when you are doing such, you're taxing the brain to think positive about yourself and the situation ahead of you. You should also be able to put interest in taking a daily inventory of your emotions. For example, if you started in the morning, between morning and now, how many times have you been worried? Maybe 2 times. What has caused you worry? You list them. What is it that you could do to manage this condition that is causing you to be worried? And you're able to do that. If it is beyond you, ladies and gentlemen, if I may ask, if some of you are Rotarians, there is a serenity prayer. In that prayer, people ask God to give them the courage to do things that they are able to do, and to, not to be stressed by those that they cannot be able to handle. And at this point, we encourage people to identify those that they cannot handle and be able to share with people that are there for them. And that leads us to identifying social support network that is strong. We have social support networks that are weak. And when we have a social support network that is weak, you cannot be able to handle the challenges of life as they come. So friends, let's purpose to stay and be connected with people who are important to us, people who build us, people who encourage us, people who carry with us the load that cause us worry and depression. Friends, do not be afraid to celebrate the little achievements. You could be depressed now because you have not achieved what you wanted to achieve by this time. But there are those achievements that you have gotten, even during this period of COVID. There are people who have made opportunities from the lockdown. And I trust that there are people, even among us, who have been able to make achievements. So even if they are small, even if they are little, celebrate those small achievements, because that is what will build your strength to live another day at a time. And therefore, make sure that your hustles do not get into the way of your mental health. When you're hustling with all these matters around you, do not let your mental health be compromised. Focus on what you can do about that situation and build on that strength to plan for tomorrow. When everything around you seems to be uncertain or threatening, take time out from people. Take time out from people. One of the issues that is causing depression is social isolation. But when we are helping people to rediscover themselves, we encourage people to think inward, zoom inward, look at your internal strength and be able to stand on that strength. Give yourself quality time to reflect and meditate on what you can do and be able to carry on with life. Friends, stop comparing yourself with others. We have grown up in different environments. What makes you sad may not make me sad. What makes you depressed may not depress me. So if another person is not depressed because of COVID-19, if another person is not, is either depressed because of, loss of a job, loss of a year, I mean, they have their own potential to manage changing situations. We are individuals, we come from different backgrounds. We have said in the beginning that Dr. Abo has laid the foundation for this discussion. It is the same even with us when we are growing up. The families that have raised us, yes?
We have 5 minutes.
I thank you. I'll be done. The families that have raised us have helped us to build that resilience in us, to be able to confront a challenge. It hits us, but we bounce back. Many a times when we fall down because of situations, but we are not able to rise up. And sometimes it is because of the law of nature and nurture. Even as we are talking now, there are some of us who have tried these strategies of dealing with the depression, but we have not succeeded because of the foundation. What is your family foundation? How has your, how has the environment, the school environment you have been to, helped you to build this resilience in you to be able to handle situations as they come? When we're starting, I said the mind, your mind, if it has been nurtured to only think negative, it is going to be a hassle for you to begin to think positive about a situation. Straight away, when you're confronted with a challenge, you will begin to only look at the negatives, and that is a big challenge. It will take you time to recover from that challenge. Unlike this person who was able from childhood, helped to develop that strength of resilience, the virtue of resilience, so that this now is a resource in him to help him handle the challenges of life as they come. Let me conclude by saying this. Even as we are talking about managing anxiety and depression, these ideas we are putting across as ways of coping and managing, they cannot work for everybody. You may find one or two issues are working for you, but the others are not. So take care and consider where you have come from. What is your family background? Has it helped you to develop this capacity, the resource to be strong, the resource to understand issues differently, the resource to accept life as it comes, and the resource to believe in yourself? I submit. Thank you very much. Back to you, moderator.
Thank you very much, Mrs. Juliet, for that wonderful presentation. We are really grateful for
You can ask them to talk to someone who can be of help. You can set up a meeting. Yes, Sacha, do you want to say anything? Are we running short of time? Okay, no, okay. Okay, we can ask this person if they want to speak to someone who can be of help. We can set up a meeting or a phone call with a mental health professional to assess safety. We can stay with them. Actually, do not leave them. Stay with them until they're in a safe environment and they have been in contact with a mental health expert. Take them to a local hospital. Do not keep it a secret. Remove any drugs, any alcohol, any guns, any sharp objects that could be of harm to them, and call a suicide hotline number. Further, in my presentation, I indicated the hotline numbers that you can use to help someone. And yeah, you can pick up on that and help out. Beyond direct intervention, the ones that I mentioned before, to stop an impending suicide, the other methods that you can use for suicide prevention include treating mental illnesses, improving on coping strategies of people who are at risk, and reducing risk factors for suicide, for example, poverty, creating support groups, and fighting suicide stigma. And that takes us to stigma and misconceptions. Stigma is a negative stereotype that can lead to discrimination. Stigma denotes a shameful quality in the individual so marked. And the fear of stigma prevents people from seeking mental health. It prevents people with mental health problems from seeking help. And if someone is very suicidal and there's a stigma about suicide, this person is not going to get help and they'll eventually end up taking their own life. But we all have the capacity to help break down the stigma and fear in our communities. And we have different kinds of stigma. We have the social stigma and have the perceived stigma. Social stigma is in a society. Perceived stigma is within the sufferer. They have their different conceptions of discriminations that they feel. And what are the examples of suicide stigmas? Some of them include asking someone about suicide may plant the idea in their head. Suicidal people are fully intent on dying. Everyone who dies of suicide is depressed. A sudden improvement in emotional state about a suicide attempt or depressive period indicates that the suicide risk is over. All these are false and all these are harmful, and all these should be broken down and forgotten. When you speak to someone about suicide, it doesn't plant the idea in their head, you're helping them. So these are some of the stereotypes that surround suicide, okay? The next the next conception, what factors contribute to the stigma? Could be family, could be teachers, could be peers. Family, for example, a research showed that 46% of adolescents with mental health problems felt or had the unwanted assumptions. I'm a burden, they do not love me, they do not like me. And some of this was contributed, or it was to the way how the family was behaving towards this particular patient. And sometimes the teachers showed fear, they showed dislike, avoidance, and underestimation of abilities of students or patients that had these suicidal thoughts in them, suicidal ideation. And sometimes the peers as well also, they have a lot of stigma, and this leads to loss of friendships and social rejection. And also social media. The media has popularized the perpetuating stereotypes, especially through film and social media, WhatsApp, Twitter, Facebook, everywhere. There are so many stereotypes about suicide. And why is suicide stigma so damaging? It's very damaging because the stigma negatively affects treatment outcomes. The perceived stigma can affect feelings of shame and can lead to poorer treatment outcomes. The stigma negatively affects the perception of others. Those with depression are often viewed as unpredictable, and most of them are sometimes less likely to be employed. And what are the different ways to challenge the stigma? One, we can participate in campaigns that address suicidal stigmas. Two, we can participate in discussions and events about mental health. And this will help improve on the willingness to help. This will improve on our attitude, to improve, promote behaviors that are associated with society, okay? It will lead to anti-stigma engagement, yeah, and it also enrich one with knowledge about mental health and suicide. Yeah, so we are running short of time, and yeah, here are the suicide helplines. There is a Butavika Hospital, the numbers are here. You can call, and the box number is there as well indicated. Then there is a Naguru Teenage Health Center, it's toll free, and there is our WhatsApp number, fully operating 24/7. You can call, anyone can text them, ask about suicide, someone who needs help. And let's not wait for someone close to us to lose their lives. Let's not wait until then. We can prevent suicide, and suicide is preventable. It's very unfortunate that we have very, very little time, but in a minute, the rooms will be closing. But that's the end of my presentation. Thank you so much for listening. I hope I have been quite audible. I pray that my network has been okay, and I pray that we have learned something. So if someone has something to comment before we join back to the main session, kindly unmute your microphone, please. Yes, Dambia Kenneth.
All right, thank you so much for that wonderful presentation. I only have one question, and I'm thinking about the manifestation of suicidal death, the means in which suicide comes about. You realize that there are individuals who commit suicide by simply taking poison, and you're going to find that there are other individuals who commit suicide by maybe self-immolation. So someone who commits suicide by self-immolation, in my sense, feels more pain than the other one who commits suicide, maybe by simply taking sleeping pills. So I just want to understand, what is it that causes a contrast with the means in which someone commits suicide? Thank you so much.
You're welcome. Okay. As I mentioned, this is more psychological, honestly. And we see and we have seen that the men are more risk takers. And these are people who, you see that majority of the men are going to hang themselves. They are going to fall from a building. They are going to maybe shoot themselves. And the women are more likely to take organophosphates or poison for that instance. And it's more psychological. I hope I've been helpful.
Yeah, thank you. Thank you.
You're welcome. You're welcome. Any hand in hand, we should be joining the main chat.
Hello.
Hello.
I also want to respond to that by saying that I think it
Mhm.
comes with the background of the suicidal ideation that keeps building and being aligned to the kind of death that a person wants to have in a sense of suicide.
Mhm.
Yeah.
All right, thank you so much. Thank you so much. Eva, I don't know who was it that spoke. Thank you, Lamich. I don't know.
Next
Recording in
session is going
progress.
to be an interdiscussion. So we are going to have people from the different groups explain to us what they have learned from that side, and then we see on how to get forward. So we are going to use 3 minutes for each of the groups. We have group 1 was anxiety and depression. Group 2 was how to deal with post-traumatic stress disorder, PTSD. And group 4 was suicide prevention. Welcome back. I know some people may be complaining about the time, but yes, we had to come back and share because we believe when you have divided, you can learn and then you come and share with the main group. So let us start with a representative from how to deal with anxiety and depression, the session which has been led by Ms. Katega Juliet. If we need someone who has been there and you have learned something to raise your hand, to unmute and say something. Yes, we are waiting for you. I saw very many people in this group, but you are all keeping quiet. Hello.
Yes, please.
I think Honorable Crispinos, you are the one who has moderated that session. I see Kabaza Fabian has unmuted and
Yes, I'm getting. I'm getting.
Yes, you can summarize in 2-3 minutes about what you have learned from the breakout session about how to deal with anxiety and depression.
Okay, thank you very much. Yeah, we've been taken through depression and anxiety, and what we've learned from there was it starts from worrying, somebody worrying a lot, then it goes to fear, anxiety, and then it migrates to depression. So in simple terms, how we can manage depression and anxiety is through manipulation of environment, whereby an individual, if he or she is depressed, one can involve him or herself.
It seems we are losing you, we are losing you, Mr. Fabian. Try to get a stable network.
Then
yes, Fabian, your network. It seems we have lost.
Yes.
Seems we have lost Mr. Fabian. Another member of the group, I saw two people had unmuted, Mr. Geoffrey.
Okay, maybe I can
Are you
take.
getting me now?
Yes, Mr. Geoffrey.
Okay, taking from what Mr. Kawaza Fabian has shared, he was on how we can control and regulate ourselves from progression from fear, anxiety, and depression. Madam Katega Juliet said that we can stop these things of comparing ourselves. You know, people have different backgrounds, and it is something bad to compare. You comparing yourself with someone would be one of the cause of stress and depression. So if we can stop comparing ourselves, then that one would be better. Then another thing, we can still go in groups. Yeah, we gain those social support. We engage ourselves in social support. This one again can help us in overcoming the stress that we see that this stress can take us depression. Thank you. I think someone can take us from there.
Thank you so much, Honorables, for that summarize from that session. After the people from the other sessions have also given us a summary, we will have a series of questions directed to our presenters in those lines, and then we will move on. So we need someone who was in room 2, that is for post-traumatic stress disorder, PTSD. If you're in PTSD group, you can unmute and say something about what you learned. Yes, someone from PTSD. Yes, I can hear you.
Good evening once again.
Good evening to you.
Yeah, I'm Honorable Nsereko Nicola, the Guild Health Minister. About the about the PTSD, which is the post-traumatic. So it involves something where we have intense, disturbing thoughts and feelings related to the experience that lasts long after traumatic events, which means that these are things which affect us, which affect our mental health due to the bad experience which we will have gone through by some past events. Then again, the counselor or also the Dr. Mwingo Sharif, he said about PTSD, it's majorly, how do we get it? It's all about how major does it affect the students? If happen to get a past event which has really attacked me seriously and really I'm down a bit, and then I try to isolate myself from one of my friends, really to affect me. Also, on the other hand, also affect what my friends, because like they won't be in position to know what I've been going through, so they'll also be with a two-mind effect or two minds, which where they're asking what will happen to this guy, and again I myself to also try to hit me in another way. So whereby this thing of situation, the one who is suffering, also those people whom I'm working with that have not tried to share. Am I clear? What I meant affects two people. If I'm the one if I'm the one who's suffering in such a situation, if I'm the one who is suffering because of this PTSD, the people I'm living with also be in suspense that how comes I'm not associated with them. So also affect them to two problems, which affect. Another thing, how we can try to keep it minimal. Also, the cancer said about like we should take a lot of fluids. I think for that it's also okay. Maybe another person can take from there.
Thank you so much for the comprehensive discussion and sharing of what has happened in that room. Surely a lot of learning has occurred. Let me invite a member from room 3 that was about suicide prevention to also come in the next 3 minutes and summarize. Then we will have a question and answer session to our presenters from the different rooms and we summarize. Yes, Honorable. Yes, Mr. Dambia Kenneth Eldad.
Right, thank you so much. Our group did talk about suicide, and the presenter did say that suicide simply means taking up your own life. And how does it begin? It begins with self-ideation, and that's having ideas of taking up your life. So she did say that you are stressed up and then you get depressed, but then the depression becomes very, very, very intense, that you reach a point whereby you lose the sense of being and feel like you are a burden to everyone around you. You're a burden to your friend, you're a burden to the community, you're a burden to even yourself. And then what you think about is that I don't have any sense of importance as to why I should live. And as a result, I have to go ahead and end my life. So she said that such kinds of suicidal behaviors can manifest themselves through an individual who's really suicidal. For instance, we can look at his moods and his behaviors and his temperaments. So you find that the person keeps on complaining or maybe sends some suicidal messages and says, I feel like taking up my life, or I feel like I don't deserve to live in the world, or I feel like I'm a burden to everyone. No one really cares about me. So she said that once you ascertain that someone is reacting with such kinds of moods and behaviors, then it would be a hint that this person is becoming suicidal. Or maybe the person is taking a lot of alcohol. He has not been taking excessive alcohol, but then he's engaging him or herself in excessive alcohol. Then that could give you a hint that perhaps there is something depressing this person, and if it is not abated, then he could possibly become suicidal. And then she talked about ways of how we can help these individuals. Is that once you ascertain that someone's becoming suicidal, don't give up on them. You check on them every day. Try to check on them until there is that recovery phase. And if you realize that you cannot do something best, then refer to a medical personnel, a person who's an expert. Perhaps he or she could help. But if you abandon them and then you don't pay close attention to them, then their depression keeps on intensifying and eventually they end up their lives. And then the other thing that we looked at is that people can commit suicide in various forms. Someone can commit suicide by self-immolation. Someone can commit suicide by hanging himself. Another one may take poison. Another one may get a gun and shoot himself. You know, there are various forms in which it can manifest itself. But then one of the unique things that really was profound was the fact that suicide is more common in men compared to women, and that 80% of people who commit suicide must have a personality disorder. So meaning that if you ascertain that someone is having a particular personality disorder, then you've got to really pay close attention to that individual so that you can avoid them from committing suicide. Thank you so much.
Thank you so much, Honorable Dambia Kenneth Eldad, for that great summary. It has been tremendous. We believe there has been very great learning. So I'm going to take up 3 hands up for questions, just 3, 1, 2, 3, and we will summarize. I've seen the first hand, that is Eva Caroline. Any other person with a question? First, wait, I want to get to the 3 people. If you have any question you want to give to ask right now, I'm taking hands right now. If I don't take the hand, we shall conclude without that question. Okay, yes, let us have Honorable Eva Caroline to ask her question. You can unmute, followed by Rangaja Stars.
Well, thank you so much, Honorable Nelson. I would love to thank Madam Nagawa so much, the one who took us through the suicide prevention. But the bad bit of it is the time wasn't enough, so I didn't manage to ask my question therein. And it goes straight to her. Like, as a student leader, last semester, before we broke off for holidays at Chambogo University, we had 6 suicide acts, and the students actually died. There was no survivor, and we were wondering how we can go about such a situation, because you told us what we can do, but that is to like an individual. But what can we do, like, to a large community to prevent it from facing those suicide acts in a, let me say, a big number of people, not one person? Because at a university, it's hard to identify that person, because you can't know we would just find them in their rooms when they've killed themselves. Yeah, so I need some clarification on that. How can we prevent suicide in large communities? Thank you.
Okay, thank you so much, Honorable Ayevar Caroline. Well, question, on a large scale, how you can intervene, how you can help. In your universities, your different universities, you could put up support groups, and support groups are very, 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 very essential. In a support group, someone will feel like they have somebody to lean on, because we see that in most suicide cases or suicide attempts that we have seen, these people have a feeling of hopelessness. They don't have a reason to live. They feel that they're so, I don't know, so hopeless, so distressed. But when you have support groups in your communities, when you have counselors in your communities, when we do anti-stigma, anti-suicide stigma campaigns in schools, these people will come out and speak about the issues. But because there's a lot of stigma in students and in peers, the people that are having this suicidal ideation, these suicidal issues, they do not come out openly to discuss, because they'll be like, hey, what is this one going to think about me? What is this one going to think about me? Because of the negative stigma that is surrounding suicide. But these people need help, and you can do that via counselors, via support groups, and also as individuals by availing yourselves to them. When someone gives you that phone call, pick it up, listen to them, give them a listening ear. Yeah, basically. Thank you.
Thank you so much, Honorable. Let me invite forgetting the name, Honorable Wanga Justice.
Thank you so much, sir. I am Luanga Justus. Sorry I came quite late, but thank you for that chance. Yes, I have two questions. One is kind of an inquiry. Since I came late, is there a possibility that you can share some of what has been shared? Maybe that you answer after here. My question is about things that are not necessarily diseases or health problems, but I would say persons with disabilities. And this has presented as also a challenge to the health and well-being of students, mainly around campus. So, I witnessed this because I'm part of a persons with disability group that is operating at MAST. Personally, I'm not a person with disability, but we were always called upon to, go out and interact with these people, ask them what exactly is taking place, their problems and all that. But we always found a challenge with, actually, it also covers people with chronic infections like sickle cells and all those other chronic infections, as we may name them. So, but the challenge would always be how exactly someone is supposed to disclose. How am I going to make people open up to share their whether it's a chronic problem or a disability, how it affects them, and how it leads now to, the suicidal tendencies that we have been talking about over the time, how I'm going to help them. And in most cases, actually, people refuse to share and end up with such tendencies because the most question they ask you, how are you going to help me? So, I really don't know whether that can actually be addressed, or we can come up with something that can generally be helpful to such people, because sometimes it's not enough to just share and you leave someone there. And actually, that's why some people don't share, because when they ask you, how are you going to help? Sometimes we are helpless too. So if we present a clear way on how to help, maybe, or there is a platform which can help, or something of a sort, maybe if we bring it up, it would be helpful. So I'm asking whether that is possible, or how exactly are we supposed to do it, and how helpful can we be in case we want them to disclose. Thank you so much.
Thank you so much for the great question. I'm seeing Miss Katega's hand also up.
Thank you very much, moderator. My name is Juliet. I would like to respond to the question that has just been raised. Human beings are social animals. And at every stage of life, there is learning. And the experiences we go through help us to develop the virtue of resilience and problem solving. The case of persons with disabilities and other vulnerable persons in our communities require us to approach their concerns from three angles. We have the problem-focused view, the emotional-focused view, and social support focused. If, for instance, somebody has a disability, I would imagine the immediate need of this person is emotional support. Be there with this person, talk to them, encourage them, walk the journey with them, whichever the journey they are talking. It is not an easy thing, but if you get emotionally connected, this person will open up to you and tells you what their problem is. And then you'll be able to go to the other level of problem-focused intervention. When you're able to handle this person's problem well, those issues of depression, mistrust, anxiety may not arise. So, to my friend, whoever you know that has a challenge, start from the emotional point of view. Connect emotionally with them, build rapport with them, support them in any way you can. Where you cannot, tell them, here I cannot. Truth be told, ladies and gentlemen, some of these mental health issues we have been a result of where we have grown up from. We have not been encouraged to solve problems. We've not been encouraged to handle problems. We have not been encouraged to appreciate ourselves to the extent that if you made any contribution, the comment from a significant person will be, okay, even you can do this, demeaning you to the extent that you don't want to try again. So all that these people need is emotional support, social support, and then they will open up to you and you know what their problem is and help them deal with it. That is my submission.
Thank you so much, Miss Juliet, for the great submission and answering that question. Let me also invite Mr. Mingo Sharif to say something in 2 minutes. Yes, Mr. Mingo.
Thank you very much for the submissions. I would like to also add my voice to what my colleague has just said. When we are dealing with people with disabilities, issues, the challenges or the mental health issues they have is as a result of either two things. One could be self-stigma, that is stigma that is caused by the individual, him or herself, or it could be stigma as a result of the environment where they are coming from. So one way to help a person living with a disability is to try and deal with the stigma that comes either from the environment or from within. One other thing I have noted also is that some